you had individually or collectively made mention of different programs that can make an impact on those families who are living in poverty. And with regard to the earned income tax credit, I have a figure here from the New America Foundation study that we're leaving about $1.2 billion federal dollars on the table of California families who qualify for earned income tax credit, the federal earned income tax credit, but are not accessing it. There are a couple of bills that are pending that will be moving forward here in the legislature that would create a California earned income tax credit. I think there are a couple dozen states that already have their own. We do not have ours. And as much as I support it, I know that there's bipartisan support for earned income tax credit in Congress, and that I think maybe Ronald Reagan might have said that it's one of the best poverty-fighting programs that we have. It's going to be a real challenge, I think, for us to find in our budget additional monies to create anything of any significance for all the many different other programs that we might want to consider as priorities, repealing the maximum family grant, the CalWORKS grant levels restoration, or the restoring the refundability of the child care tax credit. A lot of other possibilities, not to mention our higher education system, our court system, a lot of competing priorities. Do you have any idea, and I also have a list of the top 10 by population states in the country, and we're only at about 70% of those eligible accessing their EITC. We're higher state, Michigan's at 80%, New York's at about 80%, Massachusetts 77%. So that 29% that is not represents about 1.2 billion, as I'd mentioned. It would seem if we could look at what other states are doing better than we, might we invest a relatively smaller amount than creating our own earned income tax credit to get that 1.2 or a good chunk of that 1.2 billion that's just waiting there for the taking? And I wondered if you have any experience of what other states might be doing that we're not. I know that we also rank at the bottom in eligible California families accessing CalFresh, or our food stamp program. And over the years, we have done all that we've done much to remove some of the hurdles that had been in place. For example, we were the last state to get rid of the need for fingerprinting. So we looked at other states, determined what they were doing that we weren't, or that we were and they weren't, in an attempt to make sure that we're not leaving, again, federally funded program, CalFresh, that would benefit families that we're talking about today. Any ideas how we might go after that earned income tax credit that's just sitting there?
Yeah, absolutely. I think that you make an excellent point that we need to figure out how to leverage the resources that are available at the federal level, and making sure that families are aware of all of the different benefits that are available to them and access the earned income tax credit. CalFresh and other benefits is really important. I think that actually, you know, one of the benefits of implementing a state earned income tax credit is that it actually increases the likelihood that more people are going to be aware of the federal earned income tax credit and actually take advantage of it. So it actually, you know, leverages additional funds. One of the things, you mentioned other states, but one of the things that's happened at the local level, San Francisco implemented a kind of one-time earned income tax credit with the goal of really increasing the uptake of the federal earned income tax credit, and that was successful. So that could be something that we could consider. And I think we have to just continue to work with some of the local community partners that we have. There already are a lot of great campaigns to... Tax
aid. I know we do that in San Francisco. Accountants volunteer their weekend time, and we put out word on bus shelters and through other means of communication to let people know that if they think they might qualify, they should stop by a school or a community college and have an accountant look at their information and see if they might be owed money. And sometimes people walk away stunned, $2,000, $3,000, $4,000, $5,000. So I wonder if there are also, given the diversity of the state, maybe some language barriers, and how that would just meet an informational campaign. With regard, and you think I know more about this, but you seem to, with regard to the one-time program in San Francisco, sounds like there might be a lot of bureaucracy just to set up for 1 year to distribute some money that is not going to be there the following year.
I mean, I don't know all of the details. We can certainly get back to you with more, but I think it's a one-time payment. It's a continuing program, but each family is able to access the funds once.
I see.
But then again, it's connecting them with the earned income tax credit that once they're aware of it, that it's available at the federal level, can continue to access those services.
And I also want to just express my agreement with you that raising the minimum wage would go a long way in that. And do you have some percentages? I think, Ms. Kruckel, you made reference to those who are working who are living below the federal poverty line.
Well, the number of families, there are 20, actually, I'm not exactly sure about the federal poverty line, but I do know that 20% of those working are working in low-wage occupations. And I think there's always slightly different statistics, but according to mine, about 16% of the families are under the federal poverty line. And I might add to onto your idea about the earned income tax credit, there are several supports that low-wage working families are eligible for, and one of the ideas to help families access those better is something known as benefit integration, where systems are aligned to make sure that parents who apply for a child care subsidy or for CalFresh or Medi-Cal or housing vouchers are also informed and determined eligible at the same time for other benefits, which would help them keep their, especially if they're low wage, just be able to keep working and keep earning. There's just a lot of supports can be helpful to help parents keep their jobs. But it does require some real thinking on the benefit integration.
Because they don't always match exactly.
Yeah.
This is from the Children's Defense Fund that in California, 61% of poor children live with a parent who works, and 37% live with a parent who works full-time.
Right, and it's really important to remember that parents desperately want to work, and really helping them work and finding ways to support them in their work is the surest predictor of good outcomes for kids later on. I mean, parents need to feel like their jobs are stable.
There's also some agreement on the left and right spectrum of the political world in raising the minimum wage, because of course those who are working full-time and earning a poverty wage qualify for public assistance for their most basic human needs, their housing, for their nourishment, and for their medical care, which means we, the taxpayers, are subsidizing private employers rather than they pay their workers enough so they don't qualify for public assistance. We have to step forward, and so we're subsidizing the Walton family because they pay so little. And folks on the right and left think that that is not right. So that'll be debated within the legislature as well. I know we have questions from the committee.
Put me on the list, too.
Okay, we'll go to Senator Nielsen and then Senator Mitchell.
One of the societal issues over many decades is kind of the diminishment of the two-parent family. Is that a factor, and how do some of the suggestions you have here would help two parents be a part of the program? How could we encourage two-parent families again? Anyone have an idea on that? Having two parents, taking an active role. That's my point, in the lives of children. Is that anything you're thinking about, or do you have any solution?
Well, there's absolutely no question that children benefit in lots of ways when there are more adults, particularly mothers and fathers, involved in their care. And they benefit financially because you've got two incomes also contributing. You benefit relationally. Part of the difficulty is that sometimes the economic stresses on families is part of what fractionates them. And indeed, there is concern among those of us who study children's development at the growing numbers of children who are growing up in single-parent homes, mostly because the financial stresses on single parents are also impairing other aspects of their ability to parent well.
Well, even if the parents aren't together, though, an active role of the parents wherever they may be in the lives of children, I think is important, is it not?
Yes, and there have been significant advances in the last decade on child support enforcement in helping to ensure that fathers are continuing to maintain a visiting relationship with their offspring after marriages break up or if marriages never happen. There's been significant advance in those areas.
I'd like to examine that further, and I appreciate your thoughts. Another significant development, and I would argue it was one of the most significant welfare reforms in history. In fact, the Clinton welfare reform was based on California's, what was then called GAIN program, Greater Avenues for Independence, which then became CalWorks. There were many dimensions of CalWorks, but one of the fundamentals was putting people into employable skills, not jobs, not work for welfare, but employable skills. And childcare was very much a part of that. In your opinion, has GAIN and CalWorks been very helpful in this regard? I mean, we still have a problem. Has those programs, GAIN and CalWorks, been helpful?
I will try to. I think they have been helpful for many families to achieve jobs and achieve higher education, but there are a lot of rules and a lot of bureaucracies that often make it hard for parents to stay engaged in the programs. There have been obstacles along the way for parents trying to achieve higher education, for example, on the CalWorks program. It's often been very hard for them to do that. So if they get, kind of a regular low-wage job, I mean, like I mentioned before, some do get job training too, but sometimes the bureaucracy makes it a little hard for them to do that. And I also think we really have to keep in context the economic changes that have happened over the last 10 years or so, 15, since CalWorks was first introduced. I mean, we've had this incredible dot-com boom, then bust, then boom again. We have a lot of income inequality, and there's a lot of research to show how that income inequality is being manifested in the low minimum wage that Senator Leno mentioned before. So I just think we have to keep those in context. I do think CalWorks has helped a lot of parents achieve work, but there haven't been enough childcare subsidies to help all those parents, and many of the parents who are achieving the jobs are bumped off the minute they reach a plateau. So it's an income.
Well, yes, but you couldn't keep that plateau going and going and going. I mean, the key is to do what we can to make individuals self-sufficient. Wouldn't that be the ultimate goal?
Right, but as children grow, there's still, after school care, there are still costs related to raising the children, even if a parent has achieved a certain income level of $35,000 a year, $38,000 a year, but there's just still a lot of costs associated with that, and $38,000 a year isn't very much money in certain areas of the state.
Okay, thank you.
We've also reduced the time limit for how long families can access the full range of welfare to work benefits under CalWorks to 24 months, which for some families, when they're trying to figure out how to get the education they need to get a higher paying job, might not be enough time to really be able to make those improvements. And I also just want to say, kind of going back to the earlier point about two-parent families, is we also need to be thinking about this as a kind of two-generational problem. And one of the things we know is that, investing in early childhood education, investing in reducing child poverty actually increases the likelihood that when children become adults, that they are that they become, that they get married and raise children in two-parent families. So I think it's a cycle that we really need to be thinking about starting very young.
Well, we certainly do agree on that point, and that the ways that we can encourage the two-parent involvement is going to be a helpful step to the future. And we certainly agree on the bureaucratic impediments, and there are many. Whatever the program is, we end up usually putting a lot of bureaucratic impediments into everything, and I understand that. That's an area we're certainly in common and sensitive. Thank you for your answers.
Thank you, Senator Nielsen. Senator Mitchell.
Thank you, Senator Leno. Dr. Thompson, I'm going to enlist Senator Nielsen's help in finding myself a husband. And then we will come back and share with you how that worked out. And then I'll be happy to remove myself from the single female head of household roles. So Senator Nielsen's going to help me find a husband, then we'll be able to report to the experts how we can increase the number of 2 parents in the household. Help me, Senator Nielsen, I need help.
Would you marry me?
Well, I'd not trivialize it. I think this is important. Don't
I'm not
don't
trivializing
trivialize it.
either, I need help. No, okay, we have to work it out. Senator Nielsen
Senator
wants to
Mitchell, I
answer,
look
it is not trivial, it is not, but nor is it simple. And nor do I think is it easy to discuss in a policy context. Anyway, Dr. Thompson, every time you come, I learn something new, and you take my breath away, literally, with the stunning reality of decisions we're making in a public policy environment and the impact it has on the very core human development of a human being. It takes my breath away every time I hear you. Ms. Parvinsky, you shared something that was stunning, and I want to make sure I heard it correctly. $90 billion per year in lost productivity. That's a national number or a state number?
That's a state number. It's $500 billion nationally.
So it's $90 billion per year in lost productivity based on our current level of the number of children living in poverty.
Right, lost productivity and also increased crime and health costs.
Lost productivity and increased costs in health and crime. And so if we were to do nothing in terms of, in an effort to reduce the number of children being born into and living in poverty, that number would continue. Could you give me a sense of how it could potentially grow if our lack of action, frankly, increases the number of children living in poverty?
Yeah, absolutely. I mean, we know that children that are born in poverty are less likely to end up in well-paying jobs. They're more likely to end up with severe health problems, more likely to end up in the criminal justice system. So we can't afford to continue letting children live in poverty. And if we were to, through an action, increase the child poverty rate, the amount of costs to society would also increase in terms of lost productivity and those increased costs. And on the flip side, we know investing in reducing child poverty or investing in early education also saves money in the long run. And Professor James Heckman, Nobel Prize winner, has shown that those early childhood investments save money in the long term by reducing criminal justice costs, health costs, and increasing productivity.
Thank you very much.
Thank you, Senator Mitchell. Senator Pavley, and then I think we may move on to our second panel.
Thank you very much for the presentation. And I just wanted to make one comment. And they're right on target from my limited perspective, but law enforcement and everyone else and people in the education field agree that investment in quality preschools, access to health care, affordable child care, if that's even possible anymore. It's just taking up 50% of your income for just normal families without all the extra challenges. Access to libraries that are open more than a few days a week, right? Equality school. The investment early on is more cost effective than waiting till the end, where the societal costs are even more. And so I think people understand that, but the scope of the problem, and there's more and more information coming out because of the types of jobs people have to have in juggling child care and their jobs and the changing times of jobs. And I just know as a teacher, even changing 1 or 2 days in a school year's schedule is a huge deal and a huge problem in trying to fill in that gap. The person in the average field that has their Starbucks job change from maybe a convenient 9 to 5 is now in a 4 p.m. to 11 p.m. shift on a 1 week's notice. Impossible. So I was curious about how you develop relationships with the private sector, or what you can require from the private sector in a certain amount of reasonable time and sensitivity. Actually, it's just good workplace sensitivity on how you sort of know who your employees are and how difficult that is. Not only is it difficult from that child care centers aren't open other than 7 in the morning to maybe 7 at night at the max, but coupled with that, because more and more people have health care under the Affordable Care Act, those same communities cannot find clinics open other than 9 to 5, Monday through Friday. It's sort of like a double whammy. So what are they left to do? The single mom or any struggling family, they're taking the kids that could go to a clinic for preventative health care that would allow them not to miss school or preschool. They're going to the ERs and they don't have access. So it's a compounding problem where society in general is going to pay a lot more at the end of the day if we don't get this right. It's really a huge tragedy. It's income inequality, but it's everything else, and not recognizing changing demographics and roles you don't have. Middle-class families are 2-income families. There isn't someone at home anymore, right? So real challenges, and whether part of the challenges is extending traditional school age to 4 years old, so you have quality teachers, but it's still a challenge because that's a 9 to 3 situation and how you juggle all this. So I know Children's Defense Fund's been heavily engaged in this for years and years, so I was just curious how you deal with the private sector and some of these moving parts, if there's some models out there in corporate sensitivity and responsibility.
Senator Pavley, let me respond by saying that this actually is an historic moment for trying to address the issues you raise, because California is not alone in facing the changing conditions of employment, particularly for parents of very young children. And as a result, local communities and states are developing innovative models that we well could look at for how to think about changing the game. Just one example I'll offer you has to do with creating, through the leadership that the legislature can provide, public-private partnerships, recognizing that businesses themselves have concerns about the ability to, for employees to be able to work these strange shifts given their childcare needs, and the creation of a workforce that is actually going to be equal to the needs of business and industry in the coming decades. One example is what happened in Minnesota, where a fund of private money was matched by a legislative appropriation to provide scholarships to enable children whose families live below the poverty line to attend high-quality preschool programs. And the idea was that this was meant to be a model program to see what kinds of benefits could accrue from it. It was successful. The Minnesota legislature ended up coming into that program in a bigger way. It has proven to be a model of accomplishing what neither the businesses in Minneapolis could do alone, nor what the state was prepared to do by itself. I could point to a lot of examples like that. The report that I mentioned that will be coming out next April, I think, will have a list of just innovative ideas for how one can do that. Likewise, improving the quality and preparation of the workforce can involve more than top-down solutions, but incentives from the QRIS program that California is involved in developing now, but also incentives to enable those in the child care and education industry to improve their skills, to be able to benefit in their incomes as a result of doing so. There are lots of ideas. And part of the reason I would say that this is an historic moment is I think we're recognizing that the distinction between child care and early education is increasingly eroding. Because after all, from a child's point of view, every setting is an educational setting. And so it no longer is appropriate to think about where we can put kids while their parents are working and where else we put kids for the benefits of education. It's all affecting how they're learning. And therefore, all settings need to be informed by what we know are best practices for contributing to brain development and also fostering children's early literacy and other cognitive skills, beginning in infancy, which is really the great terrain of need out there. So we've got a long way to go, but there are lots of people who are thinking about this outside of California, too.
Thank you. We've got 3 more members before we get to the next panel, which is fine. But we're going to have to start self-discipline if we're going to be out of here by 1:30. We've got Senator Wynn, Senator Allen, and then Senator Mitchell has a follow-up question. Okay.
Thank you, Mr. Chairman, and thank you for hosting this. This issue has been something that I've watched for years, very passionate about it. I served on the Children's and Families Commission in Orange County, which is a version of First 5, and so I know the importance of 0 to 5. And for those who don't know, I have 2 children, 4 and 2. So I do know the concept that you just mentioned about every minute of the day, every second of the day, they're learning. I also understand when Senator Padley mentioned, well, what about the parents who has a job? You know, ironically, my husband just texted me when I was in the other committee hearing that my son is sick, and now he's going to pick him up from school for the day. And with that, though, that means that he might not be able to go to school tomorrow, meaning my husband now has to take another day off. So it's not only just a burden on low-income families, it's a burden on all families. You know, back then when I was in Orange County, it's a lot easier for mommy to go pick up my son. And I'm about 400 miles away right now. It's a little hard for me to do so. But, you know, you know, this hearing, what I would like us to look into is we're not just talking about low-income families anymore. Access to childcare is so critical from the 0 to 5. Because when they reach 5 and get to kindergarten, they either are sociable to deal with other children. Do they have enough English proficiency, especially if they're in a family that has second language? I've been teaching my 2 boys Spanish and Vietnamese and English. So when I say something in English, I go Vietnamese and Spanish as well, all 3. And then third is to be able to make sure that you know, some people, we forget it's immunization. Is when they're in preschool, they're immune to all the system of all the things that babies can have, because I received them all when I had the 2 babies in school. And some of these little diseases I never knew even existed until I had the babies. And so those are the things that we need to look at going forward, but it's just not low-income families. It's a middle-income families. And middle income in San Francisco, Los Angeles, and Orange County, where I represent, middle income, combined income is at minimum 100,000 or more, okay? Because you can't get a house in Orange County that I know of, a single-family home, maybe in other areas, and I represent one of the poorest districts in Orange County, for less than $500,000. So most people are living 2-3 families per apartment, per single family homes to share the rent. And so when we go forward, we need to look at is we want to make sure that we protect the children who are low income and their families. Haven't been on welfare, CalWorks, haven't been on food stamps as well, which is CalWorks, I'm sorry. You know, I understand that part as well. But we also need to protect is making sure that the middle class families who are trying their best and working very hard is to making sure that they also they don't go backwards. Our incentive should be to go forward, not backwards. And so, you know, one of the things that I've just done this year, I have a bill, SB 268, 268, it's a child tax credit. Previously, I mean, childcare these days is about $1,000 a month for decent, not even like the highest quality, decent. If you're a combined income of less than 100,000, you get to deduct $3,000 per child, or for 2 children, you get to deduct $6,000. So what I've done is SB 268 would be you get $4,000 deduction per child and $12,000 for 2 children in preschool. In addition, we asked to move up the $100,000 combined income to $250,000, because middle class these days, depending on where you live, $250,000 is barely, you're barely considered middle class. And so, you know, these are the kind of things that I think is important, because at the end of the day, the person who ends up quitting the job first, when there's no childcare, when you don't have grandma or grandparents, okay, will be the woman. And it's unfair that she chooses to have to choose her career versus her child or her children. I've been very blessed to be able to take my children for the first 8 months to all my Board of Supervisors meeting. I nursed each of them for 12 months, but I've been blessed to be able to do that because of my job. And so there's many others who can't, and they quit their job, because if you have to pay $24,000 minimum for your income, over 20% of your income, why would you do that? Let's just stay home. And it's always, majority of the time, it's the woman who quits the job, and it's unfair.